ድረገጻችን ላይ በቨርቹዋል በዙም አብራችሁ ተከታትላችሁ ECLA ያለበትን ቦታ ሆነ ጥያቄም ላመጣችሁ ሁሉ ትልቅ ምስጋና እናቀርባለን ያመታዊ ሪፖርቱ ወይም ደግሞ አንዋል ሪፖርቱ በኢሜል ተልኳል የምትፈልጉትን ከሆነ ደግሞ ሪኩዌስት ያደርጋችሁ ኢሜል ሊስታችን ላይ ከሌላችሁ ኢሜል በኢሜል ልክላችሁ እንችላለን እንግዲህ ለሱ ትልቅ ምስጋና እናቀርብላችኋለን ከእንግዲህ በኋላም እንደዚህ በትራንስፓረንሲ ምናረጋውን ያሳወቅናችሁ የምንሄድበት ይሆናል ሌላ እንግዲህ በዚህ ሳምንት በአገራችንም ሆነ በሌላውም ዓለም ክፍል ሁሉ ደስ የማይል ዜናዎች አሉ ECLAም አቋሙን አሳውቆ የሰላምና የፍቅር እንዲሆን ያንድነት እንዲሆን ቦታችንን ገልጸናል በዚህም ሀገር ምርጫ እየተካሄደ ነው ገና አሸናፊው ባይታወቅም አንዳንድ የሚነገሩ ከምርጫው በኋላ ሊመጡ የሚችሉ ነገሮች አሉ ይባላል ECLAም በዚህ ያንድነት ጉዞ አንድ ላይ ሆኖ ዩናይትድ ስቴትስ እንደሚባለው በአንድነት ተሰብስበን እንድንሄድና ሰላም እንዲሆን ነው የምንመኘው ማንንም ማሸነፈ ማንንም ሌላው እንግዲህ ዛሬ እንደምታውቁት በየጊዜው እዚህ ሀገር ወራቱ እየተጠበቀ ማስታወሻና የመማሪያ ጊዜ እንዲሆን ለምሳሌ ባለፈው እንደ ኦክቶበሩ ላይ ብሬስት ካንሰር እንደነበረው አሁን ደግሞ ለየት ያለ የአልዛይመርስ ኬር ጊቨርና እንትን የአልዛይመርስ ኬር ጊቨርና በጣም ሁሉ ጊዜ ስሙ የሚከብደኝ palliative care እና የሆስፒስ ኬር የምናቀበት የምንማርበት ወር ነው ኖቬምበር እና ይሄ በእውነቱ በህብረተሰባችን ውስጥም እየታየ ያለ በእድሜም ገፋ ያሉ ሰዎች ላይ እየታየ ያለ ነውና እሱን ያማክሩን ሊነግሩን ሊያስተምሩን የመጡ እህቶቻችን አሉ በተጨማሪ ደግሞ እንግዲህ ሁሉ ጊዜ እንደምንነጋገረው መፍትሄ ይዘን ለመምጣት ሁሉ ጊዜ እንሞክራለን አብሮ መፍትሄው የሚመጣበት የሚገኝበትን መንገድ ያስተምሩናል ምን እንደሆነ ያስተምሩናል ከዛ በተረፈ ደግሞ ለምሳሌ እዚህ ሀገር አድቫንስ ዳይሬክቲቭስ ይሉታል ለምሳሌ ይሄ እንደዚህ የህጋዊ ሆነ ኑዛዜ ለቀሪ የሚተው አስቀድሞ የመዘጋጀትን ደግሞ ሆስፒስ ኬር የሚባለው አንድ ሰው ፍላጎቱ ምን እንደሆነ መጨረሻ ላይ ደግሞ የሚታይበት ፖልስት POLST እሱ ደግሞ የሚታይበት ምን እንደሆነ አንድ ሰው ከማለፉ በፊት ምኞቱን እንዴት አድርጎ እንደሚያልፍ ምኞቱን ህክምናውን ክብካቤው ምን እንደሆነ እንዳለበት የሚያስረዳበት ዶክመንቶች ሊጋላይዝድ ይሆኑ አሉና ስለሱ ዕውቀት እንድንጨብጥ በእኛ ህብረተሰብ ውስጥ ብዙ ማንነጋገርበት ነገር ስለሆነ እሱን ይዘንላችሁ መተናል ዛሬ በመጨረሻ ሳረሳው እንደገና ትንሽ ወደ ኋላ መለስ ቢል አስተውሳችሁ ምፈልገው በECLA በኩል ከLA ኢንዱራንስ ራኒንግ ግሩፕ ጋር ያለውን ቅዳሜ የሚካሄደውን ምዝገባ 7 AM ፎክስ ሂልስ ካልቨር ሲቲ 7 AM ቅዳሜ ጧትና እሁድ ጧት ምዝገባው ይካሄዳል ኢዮብ ተሰማ ወንድማችን ኢዮብ ተሰማ እዛ ተገኝቶ ምዝገባውን ያካሂዳል እባካችሁ ተሳተፉ ለጤንነታችን ነው እንደው ማራቶኑን ሳይሆን ማየት አብሮ የመሰልጠኑን ዲሲፕሊን ሆኖ ትሬኒንጉን መካፈሉ ራሱ ትልቅ ሰልፍ ዲሲፕሊን ነውና ለሱ ላይ አብራችሁ ከኛ ጋር እንድትሳተፉ እንጠይቃለን ኢዮብ ተሰማን በዚህ አጋጣሚ በጣም ነው እናመሰግነው ዛሬ እንግዲህ ቅድም ያልኳችሁን ነገር ሊያስረዱን የመጡት እህቶቻችን የምታቋቸው ማርታ ታደሰ registered nurse master of science in nursing and master of public health እስከዳር ግዛው registered nurse nurse practitioner ከኛ ጋር ነች ሌላ ደግሞ ዛሬ ለመጀመሪያ ጊዜ ከኛ ጋር ያለች እህታችን ሰላማዊት ባልቻ nurse practitioner ከኛ ጋር ነች ያለችው እና ቀጥታ እንግዲህ የፓወርፖይንት ፕሬዘንቴሽን ነው የሚሆነው መጨረሻ ላይ ጥያቄዎች ካሏችሁ በቻቱ አሳውቁን እኛም ደግሞ ያለንን ጥያቄ እንጠይቃችኋለን አሁን ወደ እንግዶቹ ወስዳችኋለሁ
Thank you Jonas introduce ስላረከን አሁን ዮናስ ቀደም እንዳለው ይሄ ወር የአልዛይመርስ የፓሊያቲቭ ኬር እና የሆስፒስ ኬር መንት ነው እና ትንሽ ኤጁኬሽን slides educational የሆነ slides አምጥተናል hopefully you'll enjoy it next slide I guess ምን ጀምረው ምንድነው አልዛይመርስ ምን ያህል ዓለምን ያናውጣል ማለት ነው right now ወደ 50 million ሰው በdementia which is another form of Alzheimer's diagnosis carry የሚያደርግ ህዝብ አለ every ይሄኛው ደግሞ diagnosis is expected to double every 20 years so አሁን 50 ከሆነ ከትንሽ ጊዜ በኋላ ወደ 100 ከ20 ዓመት በኋላ ወደ 100 ሚሊዮን ይገባል እንደማለት ነው so in about 2030 about 76 million people will be diagnosed with Alzheimer's and then 145 million in 2050 just so that you know about 10 million new cases every year get diagnosed with Alzheimer's next slide in the US we have about 5 million adults living with Alzheimer's. Roughly the number is 1 in 9 adults over the age of 65 live with Alzheimer's. 1 in 3 adults over the age of 85. Out of this, about a third are women. 2/3 are women. Next slide. ይሄንን ቅድም ተነጋግረናል የአልዛይመርስ disease double ያረጋል every so often ተባብለናል አሁን በአሁኑ ሰዓት በየቀኑ about a minute every minute a little over a minute አንድ ሰው diagnose ይደረጋል ማለት እንግዲህ a minute እንዴት short እንደሆነ አስቡት እና ምን አይነት epidemic ዓለምን የሚያናጋ I know covid እንላለን ግን አልዛይመርስም is part of a dynamic disease ብዙ መልስ የሌለው በሽታ ነው and double ያረጋል እንዳልነው by 2050 ደግሞ every 33 seconds አንድ ሰው በአልዛይመርስ diagnose ይደረጋል next slide ይሄን ብዙ እንነጋገርበታለን ጥቁር Hispanic any minority group በብዙ disease ይጠቃል it could be diet related genetics it's unclear again African Americans I know nya Ethiopian American way Ethiopianos none ቢሆንም chances are we have a risk that is 2 times higher than our white counterparts Hispanics demo 1.5 times more likely to be diagnosed with Alzheimer's next slide አሁን ይሄኛው explain የሚያደርገው Alzheimer's disease ምንድነው ነው ይሄ common type of dementia ነው where 60 to 80% of cases are 60 of 80% of cases is dementia this is irreversible ማለት አንዴ diagnose ከተደረገን መመለስ መቀየር መሻሻል የማይችል የጭንቅላት disorder ነው በጣም ቀስ ያለ memory effect ያረጋል አስተሳሰባችን ይቀይራል እና simple task ማድረግ የምንችለው ለምሳሌ cooking ልብሳችንን መልበስ driving ያስቀመጥነው ዕቃ ማግኘት ብዙ memory ማለት function እንድናረግ memory ያስፈልገናል ያንን effect የሚያደርግ disease ነው next slide please በጣም ሁሉ ሰው እንዲረዳ የምንፈልገው በዚህ presentation ላይ Alzheimer's is not a normal part of aging so ያረጀ ሲመጣ እድሜ በገፋ ቁጥር መርሳት ያለ ነው ግን diagnosis በጭራሽ normal part of aging አይደለም it's just another disease part of the spectrum now መጀመሪያ ሳይኑ ምንድነው በትንሹ ትንሽ የምናቀው ነገር መርሳት ያስቀመጥነው ነገር አሁንም እንረሳለን በርግጥ ምክንያቱም በዚህ ስለሆነ እየተዋከብን ሲሆን ግን ከ65 እድሜ ጀምሮ አንዳንዴ ፋንክሽናችን ሲቀንስ አስተሳሰባችን ሲቀየር ማለት ይሄ መጀመሪያው ስቴጅ ነው ማለት ነው ምናልባት መጀመሪያው ስቴጅ ላይ ያለ there is hope advance እንዳያረግ ኢንተርፌረንስ ማድረግ የሚቻልበት ቀደም እንዳልኩት ብዙ ነገራችንን ግራ ያጋባል ምናቀው ቦታ ይጠፋብናል ቤተሰቦቻችንን ላናስታውሳቸው እንችላለን ወሬ ወይ አንድ ጨዋታ ምናቀው ነገር እንረሳለን እዚህ ሀገር ብዙ ጊዜ የሰው በተለይ older adults የሚታወቀው ምንድነው እንደምታውቁት እዚህ ሀገር ብዙ አዳልት ሰዎች ብቻቸውን ነው የሚኖሩት ከቤተሰብ ጋር አይኖሩም እና ብዙ ጊዜ ሆስፒታል በሚመጡበት ሰዓት ምንድነው የምናየው ቢላቸውን በስነስርዓት እየከፈሉ አይደለም ከቤታቸው ይወጡና ወደ ቤታቸው መመለስ ይጠፋቸዋል በፊት ስልክ እየደወሉ ቢዝነስ አካውንት ምናምን ሃንድል የሚያደርጉ የነበሩት ሰዎች አሁን ያንን አካውንት ሃንድል ማድረግ አይችሉም እና ቀስ ብሎ የሚመጣ በሽታ ስለሆነ ብዙ ፋሚሊ ማይስ ከሆነ ቢሄቪየር ሲቀየር ማይታወቅ ከሆነ ለረጅም ጊዜ ዳያግኖስ ሳይደረግ የሚቆይ በሽታ ነው እና ጃጅመንት ለምሳሌ ምን አይነት ሰው ነን ቢሄቪየራችን ይቀየራል አስተሳሰባችንን ይቀይራል ሙዳችንን ይረብሻል ፐርሰናሊቲያችንን ሁሉ ነገር ይቀይራል እና ደግሞ ዳይሬክሽን የሆነ ነገር ሲነገረን በሽታው ካለብን ብዙ ፎሎ ማድረግ አንችልም ከሰው ጋር መግባባት አንችልም ስለዚህ ይሄ በጣም አስቸጋሪና ብዙ መታወቅ ያለበት በሽታ ነው next slide ይሄ እንግዲህ እንደምታውቁት በኮሚኒቲያችን ምንድነው ቤተሰብ ቴክ ኬር ማድረግ አለብን ልጆች እናትና አባታቸውን ቴክ ኬር ማድረግ መቻል አለባቸው ይሄ በሽታም በብዛት ለፋሚሊ በርደን የሚሆን በሽታ ነው just so that you get a sense whether 83% of care providers of patients with Alzheimer's or dementia family members are the ones that are taking care of them about 60% በተለይ አበሻ I would say anywhere from 80 to 90% ማንም ሰው ነርሲንግ ሆም እንሄዳለን ብሎ የሚያስብ የለም ነርሲንግ ሆም መሄድ የሚፈልግ ሰው የለም ስለዚህ በብዛት ቴክ ኬር የሚደረጉት እነዚህ ሰዎች በሽታ ያለባቸው ሆም ሴቲንግ ነው እና ኬር ጊቪንግ በጣም ትልቅ በርደን ይሆናል እና ኮስቱ ደግሞ ለቤተሰብ ቁጭ ብሎ ያንን ፋሚሊ ሜምበር ቴክ ኬር ለሚያደርገው it's about estimated እንግዲህ it's about 18 billion hours ነው ምን ማለት ነው the caregiver ቤተሰቡ ቢከፈለው it would cost about $221 billion ይሆናል ምን ማለት ነው ይሄ እንግዲህ even Walmart annual sales like it's about half of annual sales of Walmart and it's about 8 times the annual income of McDonald's ማለት በጣም ትልቅ income burden የሚያመጣና ቤተሰብ ላይ burden የሚያመጣ caregiver ለመቅጠር ቢሆን cheap እንትን አይደለም next slide Alzheimer's is the 6th leading cause of death it's the 5th leading cause of death among adults above the age of 65 in the last decade about 71% of deaths is attributed to Alzheimer's this deaths cannot be prevented cured or slowed ምን ማለት ነው አንዴ በሽታው ካለ አልዛይመርስ ብቻውን memory problem ስለሆነ አልዛይመርስ ብቻውን ሰው ይገላል ማለት አይደለም እንግዲህ አስቡት መነጋገር ከጠፋን ከቤታችን ወተን መመለስ ካቃተን መንዳት ካቃተን ካራክስ ብዙ ጊዜ ሰው የለመደው ማድረግ ነው የሚፈልገው የሚነዳ ሰው ከሆነ ተነስቶ መንዳት ይጀምራል that puts you at risk for a car accident ability ማለት ምንሰራው ነገር ይጠፋናል ከትንሽ ሲምፕል ነገር ከመብላት እስከ መዋጥ ድረስ ልንረሳ እንችላለን እና ይሄ በጣም ትልቅ health disparity እና health ላይ ችግር የሚያመጣ በሽታ ነው next slide ምንድነው የምናውቀው what is known about this disease እድሜ ይወስናል ቅድም እንደተነጋገርነው anytime ከ65 ብዙ አንዳንድ በጣም few cases 60-year-olds could get diagnosed with Alzheimer's but for the most part it affects people over the age of 65 and then research family genetics plays a role ይባላል brain illnesses like stroke high blood pressure hypertension could play a role our diet plays a role anything that puts at risk for heart attack strokes could play a role ይሄ እንግዲህ ሳይንቲስቶች በተቻለ አቅም ጥናት ያደረጉበት ነው ይሄ እንዴት ይሄንን በሽታ ፋይት ማድረግ እንደምንችል There is hope. Physical activity, እንዳው ቅድም ዮናስ እንዳልከው ማራቶን እንሩጥ ብለሃል. Physical activity could play a role in delaying this. Mental health, meaning anxiety, depression, mood disorders, social activity. ብዙ ጊዜ እንግዲህ እዚህ ሀገር በተለይ ለትልልቆች ችግሩ ምንድነው? ሁሉ ሰው ስራ ላይ ስለሆነ እኔ አያቶች የሆኑ ወይ ስራ የማይሰሩ ቤተሰቦቻችንን ቤት ትተን የመሄድ ባህሪ አለን። እነሱ እንግዲህ ያ ሰዎች ቤተሰቦቻችን የሆነ ኢንተራክሽን ያስፈልጋቸዋል። አገር ቤት ለቡናም ከጎረቤት ጋር መጫወት አለ፣ ሀዘንም ቢሆን ድግስም ቢሆን ሰው ይረዳዳል እና ብዙ ሶሻል አክቲቪቲ ኦር ኮሚዩኒቲ አለ። እዚህ ሀገር ግን በጣም ይሄንን ላክ ስለምናደርግ puts the older family members ከኛ ጋር ያሉትን at high risk. Next slide. ይሄን እንደተነጋገርነው what are the limiting factors? Physical activity, social engagement ማለት ቡና መጠጣትም ሊሆን ይችላል፣ ከቤተሰብ ጋር መገናኘት ሊሆን ይችላል። በተለይ ለአያቶች የልጅ ልጅ ካለ የልጅ ልጆች በጣም አያቶችን ያነቃቃቸዋል። እንደዚህ አይነት ኢንተራክሽን በጣም ኢምፖርታንት ነው። ቢዚ ነን፣ ጊዜ ላይኖር ይችላል፣ ግን በተቻለ አቅም ሜንታል ሄልት ለመጠበቅ ሲባል እነዚህን ቤተሰቦችን ማገናኘት በጣም ኢምፖርታንት ነው። ኮግኒቲቭ ቻሌንጅ እዚህ ሀገር ብዙ ረከመንድ የሚያደርጉት ምንድነው? ፓዝል ሊሆን ይችላል። ለሀገር ቤት ለትልልቆች ሰዎች ደግሞ የእጅ ስራ ሊሆን ይችላል፣ ፈትል፣ anything ባህል የሚቻለውን አይነት activity we have to make sure that they continue doing that. ምክንያቱም with that memoryያቸውን ጭንቅላት ኤክሰርሳይዝ ማስደረግ ማለት ነው። እንዳልኩት ቅድም ዳየት በጣም ኢምፖርታንት ነው። ዳሽ ዳየት የሚባል አለ, which is like high in fruits, vegetables, nuts, olive oil, fish እና chicken diet. በጣም ይሄ greasy, fatty ያልሆነ diet በጣም highly recommended ነው. That helps with heart attack, strokes እና brain health as well. እንደተነጋገርነው mental health, we have to make sure depression, anxiety, አሁን ደግሞ እንደ setting of COVID ብዙ ፊር የሚደረግ ነገር ስላለ ሜንታል ሄልት መጠበቅ አለበት። ስሊፕ ይሄ በጣም ብዙ ችግር አለ። it's very very important. ስራም ተሰርቶ ሆነ ብዙም ብንሆን ኳሊቲ ስሊፕ መገኘት አለበት። ሌላው ስትረስ ሪዳክሽን ነው። እንግዲህ እኛ ብዙ አንሳተፍም በዮጋ በሜዲቴሽን ምናምን፣ ግን ቢቻል በጣም ብዙ ፓርቲሲፔት ማድረግ አለብን። one form of stress reduction meditation, ጸሎት, I think culturally ጸሎት በጸሎት ከእግዚአብሔር ጋር ብዙ ጊዜ እናሳልፋለን። ጸሎት፣ ዝምታ፣ ይሄ anything we can do የሚያስጨንቀንን ነገር ለመቀነስ በጣም አስፈላጊ ነገር ነው። ይሄን በሽታ prevent ለማድረግ vascular health, that includes heart attacks, strokes. ሌላ ነገር አዲ ያላረኩት ምንድነው? አልኮሆልም በጣም ኢምፖርታንት ፋክተር ነው። አትጠጡ አይጠጣ ሳይሆን በተቻለ አቅም alcohol intake consumption should be limited. Next slide. Financial burden በጣም እንግዲህ አስቡት፣ already ወደ 50 million ህዝብ አለ። every 20 years double ያደርጋል ስላልን በጣም expensive የሆነ disease ነው። But every year direct cost is about $200 billion just in the US. Worldwide ደግሞ ወደ $818 billion ነው cost የሚያደርገው ይሄ disease. Next slide. እንግዲህ የአልዛይመርስ presentation እዚህ ጋር ያልቃል። Martha is taking over.
Okay. Hi. I'll be talking on palliative care and hospice care. Okay, so palliative care is care for anyone living with a serious illness. It could be heart failure, chronic obstructive pulmonary disease, cancer, dementia, Parkinson's, and many others. And what palliative means is it's taking care of the symptoms. It's making sure the patient is comfortable. It can be helpful at any stage of illness, but it's best from the beginning of the diagnosis. Palliative care provides symptom relief, stress reduction, quality of life, and helps patients understand their disease and make good medical choices about their treatment. Palliative care can be given along with the curative treatment. So if I'm a cancer patient, I may be getting my chemo for my cancer, but I will also get palliative care to help me with the symptoms so that I will have less symptoms for taking care of the cancer. The consultation team usually is a multidisciplinary team. And what that means is they're comprised of physicians, doctors, nurses, social workers, nutritionists, chaplains. It's a whole team that comes together to help the family and to help the patient so that there's less symptoms and less pain. It can be provided in the hospitals, in nursing homes, and outpatient. There are a lot of outpatient palliative care clinics, or in the home. Okay, so that's palliative care. Hospice care. Hospice care, I just want to read something to you. What is hospice care? You matter because of who you are. You matter to the last moment of your life, and we will do all we can, not only to help you die peacefully, but also to live until you die. And that was written by the founder of the first modern hospice. And this is a model for compassionate, quality compassionate care for people facing a limiting illness. Limiting meaning prognosis is a month, a couple of months. The doctors have said, we've done everything, and you have a month to live. That's hospice. Usually these hospice providers work along with the palliative team, and everything is tailored to the patient's wishes. Later on, Salam will talk about the advanced directives, which are the patient's wishes. But it is to support the family, because as Skadar said, even with Alzheimer's, it's the family that's burdened with taking care of the patient. So you do need this hospice group to come to even provide respite care for the family while they're to take care of the patient. In most cases, care is provided at home, but there are freestanding hospice facilities. It could be in the hospital, nursing home, etc. So hospice services are available to patients with any terminal illness, any age, any religion or race. Okay, hospice delivery. A family member serves as the primary caregiver, usually, when appropriate, helps make decisions for the terminally ill individual. And this is, hopefully they've made prior arrangements, they've discussed the illness, and they have said, I want my son to speak for me, I want my husband to speak for me. So that's what that means. Members of the hospice staff make regular visits to assess how the caregiver and the patient are doing. But the hospice staff are available 24/7, 7 days a week. Okay. And what they do is they develop a care plan that meets each patient's needs. So my needs may be different than Eskadar's, may be different than Salamoid's. So it's different. And that's what the hospice team does. They tailor the needs of each patient. So the interdisciplinary team approach to meet patients' needs, again, physicians, nurses, hospital aides, and volunteers could also be part of this. Companionship or music therapy. So this is all the people that would be involved in hospice care. The volunteers, the physicians, counselors, social workers, spiritual and bereavement counselors. A lot of patients, families really need to go through the grieving process while their loved one is in that late stage. Hospice aides, patients need to be turned, patients need to be bathed, and this is hard on the family members. So having these aides come in and do that really assists the family members. So what are services provided for hospice? Pain and symptom management. So it really is hand in hand with the palliative care. Emotional, psychosocial, spiritual support for family and family members. Medications, if the patient is in a lot of pain, they come in with their morphine, they come in with anything that the patient needs to make them comfortable. They educate the family on how to care for the patient. A lot of times in hospice care, if it's stated that they want the hospice in their home, what happens is the home, that room becomes a hospice place. So they get the hospital bed, they have all the equipment that they need to take care of the patient within the home. And anybody can get that. All you have to do is know what your Medicare, Medi-Cal, know who your loved one's social worker is, because it is available. You just have to find it. Provide grief support and counseling. Hospice makes short-term inpatient care available, meaning I may be a hospice patient, but something happens, I can go back into the hospital, get taken care of, and come back out, but I'm still a hospice patient. Okay. Especially if there are symptoms. And one of the things I can think about is a bed sore, a real bad bed sore that the family member can't take care of. They may take them into the hospital and take care of them. Delivers special services like speech and physical therapy when needed, provides grief support and counseling to surviving family and friends. Okay, next, Salamawit Balcha will talk about advanced healthcare planning.
Thank you, Martha, and everyone at the ECLA community to include me in this discussion. This is a very crucial topic, as Eski mentioned about Alzheimer's disease and Alzheimer's care, and Martha about palliative care. This is very much important in our community specifically to have a discussion about advanced care planning. Next slide, please. So as we know, living in the US, the average life expectancy has increased over the past 100 years. Now it's 78 years, from 49 to 78 years. So we're living in a time where there's a lot of advances in the medical care. We have different treatments, different interventions to prolong the life of our loved ones who are suffering from chronic illnesses. Although that's a good thing, however, it's a double-edged sword because people who live longer are living in a very uncomfortable and sicker life and prolonging their chronic illnesses. So what that does is it creates a unique challenge for people in the community who might have vulnerabilities when it comes to making these decisions. We have people in the community who who have caregivers who make the decisions for them. We take care of our parents, and it's important to have this discussion ahead of time before their illness gets any severe. So when it comes to advanced directives, there is a law that was implemented in the United States called the Patient Self-Determination Act. And what that does is it allows the patient, when you come into the hospital, or even if it's an outpatient setting, the first question that we ask is, what do you want as far as treatments at the end of life, right? So it's your right as a patient to refuse any kind of treatment or to choose to have full treatment if you were to be in a state that you're incapacitated. Next slide, please. So what are advance directives? An advance directive is a legal document that's used as a guideline. It provides a life-sustaining medical care to a patient with an advanced disease or any kind of disability who's not able to indicate or explain or be able to express what kind of care they want at the end of life. And anyone could be at that position at any age. So this affects all of us, even all of us in this discussion, and people who are viewing this discussion right now. Any of us can be in that position at any time. So tomorrow is not guaranteed. We don't know what happens tomorrow. So it's important to have these things in place and to have our family members understand what our values are when it comes to end of life before we get there. So this diagram shows the different functions of advanced care and when it comes to advanced care planning. The two main common ones that we usually see is a living will, also a healthcare proxy, and POST. We'll discuss POST later as it affects people who work in the medical environment. But for the general public, a living will is a type of advanced directive that shows or instructs the healthcare provider what kind of wishes you have as a patient or someone who's suffering from a chronic illness. The other function being the healthcare proxy or power of attorney, or you might have heard of the term healthcare agent, is also the same thing. And we'll discuss that in the next slide. But going back to advanced directive, anyone over the age of 18 or older is encouraged to have an advanced directive. This is a legal document, and it allows you to make these decisions, or gives you or empowers you to make these decisions ahead of time before you get to a position that you're not capable of making these decisions. Another component of it is to assign a healthcare decision maker that can speak on your behalf. A lot of people ask questions about, where can I find this form? How can I apply? How can I make this form official? So it's important to know that there is no universal form for this advanced directive. It's something that you can put together yourself. However, there are different links that we'll provide at the end of this discussion that you can look into and discuss with your family members and apply and go through the different procedures that requires to make this form official. It's not a difficult form, but the most important thing about this form is to start having this conversation. I know in our community, I even think about my own family, my own parents, discussing this advanced directive. It's important to have this conversation ahead of time. We have different cultural beliefs, religious beliefs, and priorities. And so to have this discussion ahead of time empowers us to not have to go through the stress of dealing with a family member passing, and at the same time having to know the right protocols or the right procedures to respect their wishes. So it's important to think about these have this conversation ahead of time. An important thing to mention is that most hospitals, including your healthcare provider, should have the advanced directive as well as the POST form or any forms that you need regarding to the end of life and available to you at any point of care, whether it is outpatient or inpatient care. So this is available to you at all times. And even at the very first admission, I know in my experience, that's the first thing we ask or we are aware of as your healthcare providers is what are your wishes are at the end of life. Next slide, please. So discussing the living will is part of the advanced directive. The only difference is that the living will doesn't take effect until the person is terminally ill. It's a component of an advanced directive, and it's almost the same thing as the advanced directive. The only difference is the advanced directive is done prior to the person being sick or being ill to a point they cannot make these decisions, as opposed to the living will being a certain a form that will take effect after the person has lost these capacities. So it's important to think about these issues or concerns that you may have towards the end of life, depending on your age or your health condition at this time, to plan for the future. Next slide, please. So one of the other component, the third component of advanced care planning is appointing a surrogate or a durable power of attorney. So a durable power of attorney is a healthcare agent, which is an individual designated for you to make these decisions when you're in a position where you're incapacitated. The healthcare proxy or the power of attorney can make these decisions for you even before you are in a position where you're not making a decision, you're not able to make these decisions. However, it's a sign for a person that's not able to make the decision. So what are the roles of a healthcare agent? When you choose a healthcare agent, there are different components, different criteria that you can go through with the forms that will provide you at the end of this presentation. But just to give you an overview, when you choose this healthcare agent, make sure it's a person that's over the age of 18. This person is going to be an agent that will be choosing your doctor, what kind of care you receive, the type of conditions, the type of treatments you receive, the person who will advocate for you, who will accept your medical treatments, and who will know what kind of decisions you'll make at the end of life. So it's important to have a conversation with the person you plan to assign as your healthcare agent. And it's important to share this information with your families too. So there will not be any kind of surprises at the end of life. And you know that you're comfortable having this person as your healthcare agent. Other issues as far as choosing healthcare agents, it's most important to know that this person will stand up for you at the end of life. And again, these values, these concerns that you have about end of life, everybody has different choices towards the end of life. So you might have a choice where you don't want any kind of treatments. So your healthcare agent should be able to express that in front of your healthcare providers when it comes to the time that he or she has to make that decision. So make sure you discuss your wishes, discuss your concerns, and also make sure to have a copy of these information with your healthcare agent at the time that you're incapacitated. Next slide, please. The last component of advanced care planning is having a pulse. As you can see in this diagram on the right side, this is a pink piece of paper that we usually see in the hospital setting. Most of the time, the patient themselves have the original copy with them, and we keep the copy on the floor to make sure that everyone is aware of what the patient wants at the end of life. I stands for physician's order for life-sustaining treatments. So if you have any kind of chronic illness, it's important to have this conversation with your healthcare provider. If there is a reason that your health might decline, this document will help you know, your healthcare providers know what kind of treatments you choose at the end of life. This is mostly for healthcare practitioners, it's mostly for doctors, nurses, everyone in a hospital setting or outpatient setting to know what kind of choices you have. It usually complements your advanced directive. If it comes to a time where you change your advanced directive or your pulse, we usually go by the last submission or the last form that you have. So the pulse, again, it's something that you sign yourself. It's part of your medical record. It stays with you at all times. The original copy stays with you at all times, and your healthcare provider should have a copy of it. It's not clearly visible, but there's a way that you can see the details of the pulse form. It includes, I don't know if it's clear to see, but the components of the pulse includes attempting CPR, which stands for cardiopulmonary resuscitation, administering IV fluids, antibiotics, ventilator to help with breathing, and lastly, providing artificial nutritional tube. So the details of the pulse can be explained to you by your provider, or you can request for a translator or an interpreter in your facility to explain to you what are the different options that you're actually signing for. Next slide, please. So again, going back to the community, there's special cultural and ethno-geriatric consideration that we should have, us as your healthcare providers, as nurses in the community, doctors in the community. A lot of the physicians are educated in cultural competency. However, it's also important to be aware of our limitations in the community and to understand when we should speak up. So discussing advanced directive within our families, within our, for whoever you decide to be your healthcare proxy is important. But once you get to the hospital setting, and if there is a reason where the health of the individual is declining, and there is less chance of survival, it's important to have these discussions with your family and understand what kind of options you have, whether there is a treatment, what kind of prognosis, whether there's a choice to be better or not. If you have any questions, it's important to have these conversations with your healthcare provider ahead of time before things get worse. For us as your healthcare provider, we usually have an option to assess your competency when it comes to understanding what kind of education that we're providing you. However, for us to have this discussion for the community is also to empower you to know when you should step in and ask for more information or ask for someone who speaks the same language to explain what's going on with your loved ones. We live in the medical, Western medical community where a lot of weight is given to the patient a lot of weight is given to the individuality of the patient and what their wishes are. So I know in our culture is mostly, we usually have our input as a family of what we want for the person. However, in the Western medical community, it's important that they focus on the person and their individuality and what they want at the end of life. So if it comes to the point where there is a discussion to be made with the family, and it happens to be that you're not able to make these decisions before the person deteriorates, you have a lot of options. You have a lot of options. You can call upon the ethics committee. You can have a multidisciplinary conversation to see what the options are. So it's interesting because a lot of people might not know that these options are available to them and may feel like they have to make the decisions at the very last minute when at the same time they're understanding that their family member is deteriorating. So we want to prevent that, and that's why we're having these conversations. It's important to let your doctors know what your wishes are ahead of time. But if you get to the point where you're not able to make these wishes known, you also have other options. You can speak with the primary care provider. You can discuss what kind of options are available for you, to speak with the entire multidisciplinary team that's taking care of your loved one. Moving forward, is a translator needed? We talked about that earlier. If you were not to understand the different medical terminologies, when it goes to the pulse and what the different options are for the pulse, if you're not clear on the diagnosis or the prognosis of your family member, you can always have a translator explain what kind of options that you have, or what kind of decisions you can make moving forward for your loved ones. So consideration needs to be given to pain management and the cultural meaning or expression, religiosity, fatalism. Those are the different topics that are kind of taboo in our culture. We don't talk a lot about end-of-life care. And so this is moving forward for for the people in this discussion to kind of consider what kind of issues come up when we talk about religiosity, and empowering people to think about what their options are further than the cultural components of end-of-life care or religious components of end-of-life care. Another important point I would like to make is that you do have the option of making any changes in these decisions at any time. So if you make that decision today, it's not an end-all decision. So you can always review your end-of-life care, your pulse forms, also your power of attorney. This is something that you can review at any time. When it comes to the power of attorney, you can also assign a second power of attorney in case the first power of attorney is not available at the time that they're needed. Next slide, please. Some resources that we listed for you include forms that are available at the, I believe it's called Coalition for Compassionate Care of California. That's where you can download advanced directives and Pulse for free. You do also have the California Medical Association and the 5 wishes, as well as the 5 wishes that you can download these materials for a certain price as listed here. But most importantly, know that you do have these options available for you at your facility, your healthcare practitioner. these are usually the first questions that they ask you. So it's important to know that these options are available to you for free at your own healthcare provider, or if you happen to be hospitalized. So this is the end of the advanced directive slides. Thank you.
Okay. እነዚህን እንግዲህ በጣም ብዙ ኢንፎርሜሽኖች ናቸው የሰጣችሁን ከባባድ ቃላቶች ነው የተናገራችሁት እና ይሄንን አጣጥመን እንዳላችሁት እንግዲህ በእኛ ኮሚኒቲ በእኛ ህብረተሰብ ውስጥ ማህበረሰብ ውስጥ እንደዚህ አይነት ነገሮች ብዙ አልተለመዱም እንደዚህ አይነት ነገር ንግግሮች በግልጽ በቤተሰብ ውስጥ እንኳን አይነጋገሩም ግን አንድ ያስታወሰኝ ነገር በድሮ ጊዜ አሁን ኢትዮጵያ አንድ ጊዜ በተመለስኩበት ጊዜ ንጉሶች እንኳን ድሮ በላሊበላ አካባቢ ይመስለኛል የሚሞቱበትን ቦታ ያዘጋጃሉ ቀድሞ እና ያን በጣም ገረመኝ በእነሱ ጊዜ እንኳን ሞትን ተቀብለው የሚሞቱበትን ቦታ አዘጋጅተው እንግዲህ ፓወር ላይ ያሉ ንጉሶች የሆኑ ግን ያንን ጊዜ መቼም እንደሚመጣ ስለሚያውቁ ያረጉታል ግን አሁን እንግዲህ ህይወት ያጣደፈን ብዙም ለምን እንደሆነ ምክንያቱ አይገባኝም ግን ይሄንን ነገር በጣም አቮይድ እናረጋዋለን እነዚህን ንግግሮችና ከመጀመሪያው አሁን ከአልዛይመር በጀምር አንድ ለምሳሌ ድንገት እስከ ዳርም ሌሎራቸው ክሮኒክ ኢልነስ ሲባል አንድ ሰው በጠና እስኪታመም ድረስ ወይም ደግሞ በቃ ክሪቲካሊ ኢል እስኪሆን ድረስ ነው ወይስ አሁን ለምሳሌ ስለ አልዛይመር ስናወራ አልዛይመር ገና ሲጀምር ክሮኒክ ነው ተብሎ ሊወሰን ይችላል እስከ ዳር
so basically chronic ስንል critical ማለት አይደለም አንዴ በዛ በሽታ ዳያግኖስ ከተደረገ ከዛ በሽታ ልትላቀቅ ማትችለው ነገር ነው ለምሳሌ አሁን ሃርት አታክ ከያዘ ወይ ስትሮክ ከያዘ አንዴ ስትሮክ ከያዘ ሁሌ የስትሮክ በሽተኛ ተብለ ነው የምትጠራው the same concept አልዛይመርስ በጣም ቀስ I think የሆነ ጥያቄ ነበረ ትንሽ ብታስረጅን አልዛይመርስ ምን ማለት እንደሆነ ሚላይቻለሁ እኔ ምን ማለት ነው የአይምሮ በሽታ ነው የአይምሮ በሽታ ሲባል mental illness and depression anxiety ሳይሆን ከጊዜ በኋላ the way እንትን ጭንቅላታችን አሰራሩ እየተቀየረ የሚመጣበት disease ነው ማለት እድሜያችን እየጨመረ ከሄደ በኋላ 60 usually ከ65 አመት በኋላ ፋንክሽናችን ለምሳሌ ጭንቅላታችን በጣም ፓወር ሃውስ ነው አይደለ አንድ ነገር የምናስበው በጭንቅላታችን ነው ልባችን የሚመታው በጭንቅላታችን ሁሉ ነገር ኮንትሮል የሚያደርገው ጭንቅላታችን ነው የጭንቅላታችን ከጊዜ በኋላ እየደከመ ይመጣል I think በአማርኛ መጃጀት ማለት ነው መሰለኝ መርሳት ይጀምራል ኮንፊውዥን ይመጣል ሲምፕተሞቹ really እነሱ ናቸው የምታረጋቸው ነገሮች እየረሳ እየጠፋ ይመጣል disease በጣም the way explain የሚደረገው progressive ማለት አንዴ ከያዘ እየቀጠለ እየተሸረፈ እየጨመረ የሚሄድ በሽታ ነው ባንዴ ለበቃ አንዴ ካለ ለዘላለሙ የሚኖር በሽታ አይነት ነገር ነው that's what chronic is አንዴ እስከዳር አልዛይመር ሳላት ከተባለ እስከዳር ከአልዛይመር ጋር ነው እንትንም አይደንቲፋይ የምትደረገው እንደማለት ነው
እሺ አሁን በዚህ ላይ ያለን እንግዲህ በቤተሰብ ውስጥ ቅድም እንዳስቀመጥሽልን በብር ቢተመን በሰዓታት ቢተመን ምን ያህል ገንዘብና ምን ያህል ሰዓት እንደሚፈጅ ይሄንን ነገር ለማድረግ ድንገት ማርታ አንድ ሼር ታደርጊዋለሽ ስክሪንሽን ሁላችንም እንድንታይ ባክሽ ከጨረስን ዲ ኤንድ ሚለውን ያያየው በቃ አዎ እና አሁን ይሄን እዚህ ላይ እንደዚህ ቤተሰቦች ላይ ያለውን ብለሻልና ብዙ ጊዜ እኛም አሁን ለምሳሌ በቤተሰብ ያሳለፍኩት ነገር ነው አንድ ብዙ ጊዜ የሚባለው ይሄ በሽታ እንደውም ከታማሚው አስታማሚውን በጣም ይከብደዋል ለዚህም ነው I think ብዙ ሰው አሳልፎ አባቱን እናቱን ወንድሙን ለሆስፒስ ኬር ለመስጠት የማይዘጋጀው ለምን ያሉበትን መንገድ ስለሚያውነውና ለሚያስታምሙ ሰዎች አሁን ለምሳሌ አለ መረሳሳት ይኖራል በባልና በሚስት መሃል አላቀሽም ወይ አላቀህም ልጆች መሃል ማና አንተ ማነሽ አንቺ የሚባል ነገር አለና ለአስታማሚዎቹ ምክር አለ ወይ በእናንተ በኩል እንደዚህ ነገር ሲመጣ የምትመክሩት ነገር አለ ወይ እስከዳር
ይሄ እንግዲህ በጣም በሚያሳዝነው ሁኔታ ብዙ ኢንፎርሜሽን ምንድነው የሚባለው ለምሳሌ እናት ወይ አባት ከረሳ በተቻለ አቅም በየጊዜው እናትህን አባትን ይሄድ ማየት አለበት ሜዲካል ወርልድ ውስጥ ምንድነው የሚባለው ሪኦሪየንት ማለት እኔ እስከዳር ነኝ ልጅሽ ነኝ ይላል ሁሌ እንደ አዲስ ማስተማር አለበት ደግሞ ሲመጡ ምንድነው የአልዛይመርስ በሽታ ችግሩ ምንድነው አሁን መስጣቸውን ኢንፎርሜሽን ሊያስታውሱ አይችሉም በስንት ዓመተ ምህረት እንደተወለድክ ግን ያስታውሳሉ ስለዚህ በጣም ፔንፉል የሆነ ነው በተለይ ቤተሰብ እናት አባት እንደዛ ሆኖ ማየት ግን በተቻለ አቅም ያን ኮኔክሽን እኔ እከሌ ነኝ መቼ ነው የተወለድኩት በዛ ደጋግመ ያንን ኢንፎርሜሽን ማስታወስ መቻል አለበት እና በተቻለ አቅም ደግሞ የማያውቁት environment ለምሳሌ አሁን ሆስፒታል በሚገቡበት ጊዜ በጣም ሃይሊ ሪኮመንድ ማናረገው ምንድነው አልዛይመርስ ያለው በሽተኛ ሆስፒታል ከገባ ጭራሽ ሞር ኮንፊውዝድ ሆኖ ነው የሚወጡት ምክንያቱም የማያውቁት environment ላይ ነው ስለዚህ በተቻለ አቅም የልጅ ቤተሰብ ያለውን ሰው ሁሉ እየወሰዱ ማስታወስ ይሄ እንደዚህ ነው ፎቶ ማሳየት memory ቪዲዮ ማሳየት ይሄንን የመሳሰለ ነገር ይረዳል ግን ብዙ ትሪትመንት ቴራፒ ምናምን ብዙ የለውም አንፎርቹኔትሊ
አዎ እና አሁን early stage አለው ብለሻል አንዳንድ ነገር የመርሳት ቁልፍ ያስቀመጥንበትን ቦታ የመርሳት አሁን ቅድም እንዳልሽው ከድሜ ጋር ያገናኘው ሁላችንም እንደዚህ አይነት ነገር ይኖራልና አሁን ለምሳሌ አንዳንዴ የውነት ባይኔ ይታየኛል በሐሳቤ ግን የት እንዳረኩት አላቅም ምናምን አሁን በቤተሰብ ውስጥ እንደዚህ አይነት በሽታ ካለ አባት ወይ አያት እንደዚህ ከታመሙ በዘር የሚተላለፍ ነው ይሄ ነገር ወይስ እድል አለው
ማለት ጄኔቲክስ እንግዲህ ይሄ የተጠና ነው ግን ጄኔቲክስ plays a role ማለት ጄኔቲክስ በቤተሰብ ሂስትሪ ዲፖዚትስ ሁሉ ነገር ፋክተር ያረጋል 100% የሆነ ነገር አይደለም ግን that's why ቤተሰብ ካለ ለምሳሌ አንድ እናት ወይ አባት በእንደዛ ካለ በተቻለ አቅም you have to remain active ጭንቅላትህን ማሰራት ክላስ new information እኛ በርግጥ እድሜያችን ሲገፋ ትምህርት ቤት መመለስ አንወድም እንደምታዩ ከሆነ አፋድ በሽተኞች በ91 አመታቸው ትምህርት ቤት ተመልሰው ምክንያቱም ጭንቅላታቸውን ሉዝ ላለማድረግ በጣም ብዙ አክቲቪቲዎች ውስጥ የሚገቡ ፈረንጆች አሉ ያ የሚያደርጉት ምንድነው ወደው አይደለም ማረፍ ሳይፈልጉ አይደለም ግን ጭንቅላታቸውን ማጣት ስለማይፈልጉ ነው ስለዚህ ብዙ ጊዜኛ አሁን ሪታየር አረግን በቃ ቤት እንዝናና ነው ምናስበው አይደለም እኔም ሪታየር ሳረግ እንደዛ ነው ግን በተቻለ አቅም ኒው ኢንፎርሜሽን ጭንቅላትን ማሰራት መቻል አለበት በፋሚሊ ሂስትሪ ደግሞ ካለ የሪስክ ፋክተር ሊሆናል የሚባለው ሜክ ሹር ኮሌስትሮል ሎው እንዲሆን ምክንያቱም stroke ከያዘ definitely chances are the area of your brain affected ስለሚሆን ለmemory loss ለአንዳንድ ችግሮች ያዳርጋል ስለዚህ ሌላ ዲዚዝ እንዳይኖር ሃይ ኮሌስትሮል አልኮሆሊዝም መጥፋት አለበት ጭንቅላትን በተቻለ አቅም ስትረስ ፍሪ ማድረግ ነው አሜሪካ ውስጥ የተኖረ ስትረስ ፍሪ የሚባል ነገር የለም ግን ይሄ ሁላ ነገር የሆነ ሜንታል ብሬክ ያስፈልጋል ጭንቅላት በጣም ብዙ የሚሄድ ከሆነ እሱ ሁላ ኢምፓክት ያደርጋል የሚባል አስተሳሰብ አለ እንደ ሜዲካል ኮሚኒቲ
ኦኬ ስለዚህ እድሜውንም ሳንገድብ ተዘጋጅተን መጠበቅ ነው እንደምንም ከልጆቻችን ጋር ዳማ መጫወት ሜሞሪ ጌም የሚጫወቱት እነሱ አይ ቲንክ የሚጠቅም ይመስለኛል እሱ ለልጆች ላለን እና ራሳችንን በተቻለን አቅም አክቲቭ ማድረግ መጽሐፍ ማንበብ ወይ ማስታወስ ያንን ታሪክ መልሶ መጽሐፍ ምናምን እንደዚህ ሊጠቅሙን ይችላሉ ይሄንን ዛሬ ይሄ አብሮ የተገናኘበት ምክንያት የአልዛይመር በሽታና ወደ palliative care ይሄንን ነገር በደንብ ባቀው ይሻለኛል which is palliative care ወደሚለው ስንመጣ የህመም ማስታገሻ እንክብካቤ ነው እንግዲህ ማርታ ወዳንቺ ከመጣው ይሄ የህመም ማስታገሻ እንክብካቤ ከሆስፒስ ኬር ጋር አንዳንዴ እናገናኘዋለን እና ልዩነት አላቸው ወይ are there differences between palliative care and then hospice care ሁለቱን አንድ ላይ ይጣመራሉ ወይስ ተለያይተው ነው የሚካሄዱት
both. ሁለቱም መሆን ይችላል. Palliative care, you don't have to have a prognosis date of saying, you know what, we're giving you 2 months to live. ስላሉኝ አይደለም palliative care ያለኝ. I could be in a cancer treatment where my chemo is going fine and the tumor's shrinking, but I'm having pain. So I need the palliative care in conjunction with my treatment.
እሺ ስለዚህ አሁን በዚህ ላይ ብንሄድ palliative care ማን ነው ትሪትመንቱ የሚሰጠው? Who are treated for palliative care?
Anybody who has a disease that requires it, whether you have Parkinson's, Alzheimer's, and you're being treated for it, congestive COPD, heart disease, you will need, it's the multidisciplinary team that gets together and says, okay, while this group of doctors are treating Martha, this group of doctors are going to make sure she is symptom-free. Like we take care of all the symptoms so that she can breathe easier, so that she's not in pain, so that she can sit up, so that she can turn. So it's in conjunction. No, anybody can get palliative care. The hospice care is what differs, because hospice care is Martha's been given 2 months to live. So hospice means there's a prognosis, a date where end of life is around the corner, but I could have palliative care with it to take care of the pain. As I stated in that statement, it may be end of life, but I can live a good life until my end of life, a pain-free life.
ስለዚህ ብዙ ያተኮረው ፔኑ ላይ ነው ማለት ነው። ኮምፎርታብል የማድረግ
እንክብካቤውን
ለዛ ለኮምፎርት ኬር ነው ማለት ነው። ኦኬ ስለዚህ አሁን ሆስፒስ ኬር ውስጥ ሆኖ ይሄን ትሪትመንት የሚያደርጉ አሉ። ቀኑ ሆስፒስ ኬር ለመግባት ውስን አለው ወይ? አንድ አመት እድሜ ከተሰጠኝ ይፈቀድልኛል ሆስፒስ ኬር? 6 ወር ነው? 2 ሳምንት ነው? ይሄንን የሚወስነው ማን ነው? ደግሞ ይሄስ ከሆነ ሊሚቱ ምንድነው ብለሽ ትነግሪናለሽ?
እሺ ሊሚቱ I'm trying to find it for you. Prognosis is between the group of doctors taking care of you will say አንድ ወር 2 ወር ቀረሽ. I can give you an example. I don't know if this is a good time, but I went through it with my mother. She had a massive stroke last year, and the doctors called me to DC. I went to DC and they said, we're doing everything. They did an MRI. She had a tube. They were feeding her. They were giving her IV. 10 days into the ICU, the doctors got together, the interdisciplinary team got together and said, Martha, we don't think your mom will survive. She has maybe 3 weeks to maybe 6 weeks to live. So what do you want to do? We cannot keep her here, so we're thinking of sending her to a nursing home, but what is your plan? Okay, so at that point, I made the decision to say, okay, my mother never wanted to go to a nursing home, so can I take her home to her home, and can you convert her home to a hospice? Because they had given me 3 to 6 weeks to live, they said, yes, go home, clear out her bedroom, we'll send you all the equipment. And that's what I did. My mom's home became hospice. I took care of her. They sent me nurses. The interdisciplinary team were on call 24 hours. I had an RN come check on me. I had aides that come help me turn my mother. I suctioned her. Her systems had shut down, so she couldn't get fed. So I only was wetting her lips to, and she died peacefully. I had morphine. I had other medications so that she would not be in pain. So that's the palliative part of it. And the nurses, and I had a clergy come in, a Protestant clergy who prayed with me. And so I had all the groups, all the interdisciplinary people come in and help. And she died holding my hand in her bedroom.
በጣም ገባኝ አሁን የምትዩ እንግዲህ ከሁለቱ እንዴት አድርገው እንደሚሄዱና የፓሊያቲቭ ኬር እና የሆስፒስ ኬር አብረው እንዴት እንደሚሄዱ እንደውም የራስሽን ፐርሰናል ኤክስፒሪየንስ ነው የነገርሽንና አሁን በዚህ በፓሊያቲቭ ኬሩ ላይ ያሉ ሲምፕተም የዚህ የበሽተኛው ምልክቶች ሲምፕተሞች ይጠፋሉ ወይ ለጊዜው ይጠፋሉ ግን ያው የመጨረሻው አይቀርም ግን ለጊዜው ሲምፕተሞቹ will they be relieved
Mostly, I mean, the palliative care, for instance, for excruciating pain, whatever pain she had, I was giving her morphine, not too much to slow her breathing, but enough to make sure that she would sleep for a couple of hours without moaning. Moaning is a sign that you're in pain. So it's afad. Good. For somebody who's in hospice, they may come back after 2-3 hours. I don't know if Salamoit and Stadar want to add anything on this, but that was my thing. I had medication to prevent her from thrashing around, so it helped her to stay calm. So they give you enough medication not to subdue the patient, but to make sure it's a quality of life, that she sleeps. I mean, she was just sleeping the entire time, and in the 4 to 6 weeks, she passed, as they said.
እንግዲህ ሁሉ ጊዜ እንደዛ ነገር ስነጋገር የፐርሰናል ኤክስፒሪየንስ ይጨመርበት በዛ ላይ ያንቺ ደግሞ በዚህ ፊልድ መሆንና ምታረጊውን ማወቅ ሲጨመርበት ለኛ ትልቅ ትምህርት ነው የሚሆነውና በጣም ነው የምናመሰግንሽ በዚህ አጋጣሚ ይሄን ሁሉ ስለነገርሽንና አሁን እስከዳርና ሰላም መጨምሩት ነገር ካለ ወደሚቀጥለው ጥያቄ ከመሄድ በፊት እዚሁ ላይ ሆስፒስ ኬሩ ላይ
አንዴ እኔ ልጨምር እችላለሁ
እሺ
from anything that you've seen or heard this evening, the main thing, especially coming from our culture, you have to have that conversation with your loved ones. What do you want me to do when you die? I had that conversation with my mom. And she looked at me like, are you crazy? I said, no. You come from a family of 12. I'm not going to argue with anybody. I need to know where you would like to be buried. And she said, Ethiopia. I said, okay. What, I knew the church, a Protestant church. I said, what hymns would you like sung? In my culture and my religion, there are hymns. And my mother had favorite hymns. So I made sure to contact the church and say, I want these hymns. I want this case. And it was easy. After that, when she passed, all I had to do is bundle her up and take her home, and her wishes were done. But it wouldn't have happened if I hadn't had the conversation 3 years ago, if I didn't have an advance directive. And what Salamoit said, I literally had my cousin as a witness to make sure I had somebody watch that I was not coercing my mother into signing an advance directive, that it was a mutual understanding that she did not want CPR. She did not want a tube down her throat. She did not want all these things. I had somebody watch. I had 2 people, my father's side and my mom's side. They witnessed the advance directive. I had it notarized and I kept it everywhere so that when it did happen, all I said was, I have an advance directive. I'm my mother's agent. I'm taking care of her. So that is what I want everybody to get. Just have the conversation with your kids, with your moms, just have that conversation. It's uncomfortable, but you do need to have that conversation.
Okay. አሁን ወደዚህ ወደ advanced directive እና ወደ physician orders for life sustaining treatments እንመጣ ሰላም አሁን ለምሳሌ እንግዲህ ንግግራችን የጀመርነው it's with Alzheimer's እና Alzheimer's የመርሳት ነው ብለን ተነጋግረናል እና እንደ ልጆች ሆነን እንደ ወንድም እንደ ቤተሰብ ለዛ ሰው እንክብካቤ የምንሰጥ ሰዎች ከሆነን ያ ሰው እንኳን እንደዚህ አይነት ህጋዊ ዶክመንቶችን ለመፈረምና ለመጻፍ ቀርቶ ለሌላ ነገር በቂ ብቁ ካልሆኑ የኛ ስራ ምንድነው የሚሆነው legally can we say yes my father my mother she has Alzheimer or he has Alzheimer they cannot comprehend what's going on so I'll take over የሚል ብለን ህጉ ይፈቅድልናል ያለ ለማድረግ ቀድመን ካላረግን ማለት ነው ይሄን
ቀድመህ ካላረግ still option አለ in the hospital setting ብዙ ሶሻል ወርከሮች አሉ ኬስ ማኔጀሮች አሉ እንደዚህ አይነቱን ዲሲዥን አሲስት የሚያደርጉ ወይም ይሄን ነገር like conversation ላይ ያላመጣው ነገር ከሆነ they can give you that opportunity to discuss it and make it official. So it's never too late, but it helps you to make these decisions ahead of time. I think culturally sometimes when we talk about making the person comfortable at the end of life, officially, if you didn't explain this ahead of time or discuss your advance directives with your family or who your healthcare agent is ahead of time, you might be in a position where people in your family can think the treatments that you're given will prolong your life or will make you better in any way or shape or form. So it's important to have the discussion ahead of time, but you always have the option to have that discussion as a family member, as someone who is the primary caregiver for your loved ones in the hospital setting, even in the outpatient setting. You can have that conversation with the social worker. You can bring it up to any healthcare provider, but the social worker will be your main alliance. They will provide you with any information that you need in any language to discuss what the options are moving forward. It's never too late, but it's important to have that discussion ahead of time and to know what kind of treatments is available for your family member, whether it is to help them be more comfortable approaching the end of life, or if there's any discrepancies or any misunderstandings in your family of what the final treatment is for your loved ones or what their wishes are at the end of life.
Okay, እዚሁ ላይ ያለን አሁን እንግዲህ ቅድም ያነሳሁት is also about we talked about Alzheimer ግን ለምሳሌ እግዚአብሔር አይበልና በድንገተኛ አደጋ የሚሞት ሰው ሊኖር ይችላል በመኪና አደጋ መሞትም ሳይሆን ለምሳሌ በመኪና አደጋ ውስጥ ሆኖ ሰው ሆስፒታል ውስጥ የሚቆይበት ጊዜ ሊኖር ይችላል ያ ሰው ምንም አይነት ሊግል የሆነ ዶክመንት ወይ ኑዛዜ የምንለው ወይ ዊል የጻፈው ነገር የለም አስታማሚው ምን ያህል ፓወር ይኖረዋል ወይም ደግሞ እንዴት ነው shift የሚያደርገው አይ ባለቤቴ ወንድሜ እህቴ ይሄን አይፈልጉም ለማለት እንዴት ነው shift የሚያደርገው ፓወሩ ወደ አስታማሚው
So ሳስበው only I remember one experience with a family member that I had not a family member but a close friend of mine who had a very young 18 years of age their son had a car accident and overnight he was completely like in a vegetable state and so that person the whole family arrived to the ICU right away nobody had this discussion about having any kind of advance directive end of life care this is not something that was never had in the family so I remember the mother specifically having a prayer meeting overnight to pray for her son. And the son was attached to an EEG machine. She was praying for the son and she had a vision about the son telling her he was trying to come back, but he couldn't come back. So she wakes up at that very moment and watches the EEG machine having artifacts, we call artifacts, but movements in the EEG machine. In her mind, as somebody who's Christian and a believer, it's something that's positive, like her son is going to live. At that point, no discussion has ever been made about end of life care or any of that. So being present in that moment, the first thing that we've done for the ICU nurses and the doctors is to right away involve the doctors and the social workers to the decision moving forward or helping the family and the mother understand what's going on. And so in our community and people who might not be in the healthcare environment might not understand what artifacts are, or if something is a positive reading or not, or if their loved one has an option or a positive outlook on being able to live or any of that. So it's important to reach out to whoever is taking care of that family member, if it's in a hospital setting or in outpatient care, or even in hospice care, like Martha mentioned earlier, to see who are the healthcare providers at that time and connect with the social worker and have a discussion with the family together and make an understanding of what's happening and what are the prognosis for the patient. And so that option is always available, whether it's in the hospital setting or the outpatient setting.
Okay, so እንደገባኝ ከ18 ዓመት በላይ ለሆነ ሰው ሁሉ legally
anybody
ዲሳይድ ማድረግ ይችላሉ ማለት ነው። ማርታ ወደ አንቺ ልምጣና ለምሳሌ አሁን በእኛ በካልቸራችን በማህበረሰባችን ብዙ ጊዜ ሰው ምን ይለኛል የሚለው ነገር አለ አይደለ? እንዴት ነው አንድ ሰው ካለፈ በኋላ ያ ሰው እኛ ከምናምንበት ወይ ማህበረሰቡ ከሚያምንበት ውጪ ምኞት ካለው እና ሌላው ሰው ማያቅ ከሆነ ማርታ ካንቺ ኤክስፒሪየንስ ከዘመድ ከቤተሰብ የመታዘብ ወይ ደግሞ አንቺን የመቆጣት ለምን እንዲታረጋለሽ የተባልሽው ጊዜ አለ ማርታ?
እናቴን ይቅርታ በሁለቱም ነው ማወራችሁ። እናቴን when I took my mom to her apartment and she was she was comatose. So she had left-sided weakness. Her right side was moving. Everybody in her building brought fit, shorba, and they kept it and they said, "Ilsiyen gabiche labalat no." And I go, no, tabalot achulum, mablat achulum. ምን አይነት ልጅ ነሽ? ለምንድን ነው ሼን ሾርባ ማታጠጫት? ያድናታል አያድናትም? To explain to them, her systems have shut down. So the only thing I can do is wet her lips. Was not something, one lady literally berated me and I had to sit her down respectfully and say, I had to explain, her gag reflex, her stuff. If you put something in her mouth, it's going to go into her lungs and she's going to be miserable. And that's why we're not feeding her. So it took a few days after I brought her home for everybody to say, oh my God, she's not being fed. I go, no, it's a very hard concept to accept. And it really takes patience on, it's not because I was a nurse. You have to be patient. These are her so they're saying and for me to say we can't do that. She just needs to wet. Everything was stopped, and that continued for 4 to 6 weeks before she passed. 4 weeks. So every day it was like, don't bring anything, and they go, no, it's our culture. So sitamam mugabiza fatwatiza shorwaiza heda tabalala tatatala. And when somebody's in hospice and they've literally all their systems have shut down, there's nothing you can do but pray that she goes without pain. And that's what my goal was. The palliative care, we kept her pain-free, we kept her comfortable, and she died peacefully. So that is something that we have to understand, that like the mother who saw the artifacts and said, my son's coming back. That is something that as a mother, I would probably say, but explaining and finding that's why this is wonderful for Ethiopia, for our culture, because you can ask the questions and you can find out, what should I say? What questions should I ask? Never go to a hospital without an advocate, meaning somebody who understands what's going on. You need to have that. It's very important in this day and age.
ለዚህም ነው እናንተ ያላችሁልን ኢሴልም የሚሰራው ለዚህ ነው። ለምን እንደዚህ አይነት ዕውቀቶች ስንነጋገርና ብዙ ጊዜ በግልጽ ማንነጋገረው ነገር ስንነጋገር አሁን ለምሳሌ ከእንግዲህ በኋላ ጥያቄ ቢኖር ስለዚህ ነገሮች ወደኛ የመጡ ሰዎችና እናንተንም ጠይቀን መልስ ለማግኘት ይቻላል። ኮምፎርታብል መሆን አለብን። ስለዚህ ነገር ስንነጋገር የምትሉን እናንተ ሶስታችሁ የምትመክሩ ነገር ምንድነው? ኮምፎርታብል ሆነን ማይቀር ነገር ስለሆነ የሰው አሟሟቱ አይታወቅም፣ ግን ሁላችንም በግልጽ አዲስ ቤተሰብ የመሰረትንም እናት አባት ያለንም ሁላችንም ለቀሪውና ላስታማቢው እንዲቀል እንደዚህ አይነት ነገሮች ተነጋግረን አሁን እንዳልሽው ቤተሰቦች ይሄንን ቢያውቁ ኖሮ ማርታ በዛ ጊዜ ያሳለፍሽው ጊዜ ይቀል ነበር። ከቤተሰቦች ጋር ከመጨቃጨቅ ሳይሆን የፍቅር ነው፣ ግን ከመከራከር ከማስረዳት እንደዚህ አይነት ዲስካሽኖች ቢሄዱ ኖሮ በሌላው ካልቸር የምናየው ያውቁታል እና የመቀበል ሁኔታ አለ። እንደዚህ አይነት ነገር ሲመጣ የመቀበል አለ። በዚህ ላይ አንድ ጥያቄ መጥቷል ላንቺ ማርታ፣ ይሄን ሁሉ ስታረጊ እንዴት ነው ይሄንን ዊዝደሙ ዕውቀቱ ከነርስነትሽ ሊሆን ይችላል፣ ግን ፔሸንቱና ኤነርጂውን እናትን የሚያክል ነገር ይዞ ለዚህ የገፋፋሽና በግልጽ ለመነጋገር ያበቃሽ ከ2 ዓመት 3 ዓመት በፊት ምንድነው?
እግዚአብሔር I'm sorry, it's faith. I could not have done a single step from the moment I got the phone call. Your mom is in the hospital, George Washington Hospital. To go to a different state and to carry out hospice care for my patient in where the rules and laws are totally different. I could not have done it if God did not walk me. He literally opened doors. Every single step I took, doors were open. I had a wake for my mother in DC. I don't know DC. I've never lived in DC. I went to a grocery store and the guy said, do you know of any halls? I need to have a wake for my mom's friends. My mom passed. He goes, I have a room upstairs. As long as they can go upstairs, you can have it, but you need to pay me my $600 today and you can have it. It was just amazing grace of God opening doors every step of the way to the point where I went. I buried her. I brought all her friends together, all her friends who were in Ethiopia, and spent time with them and came back. For me, I couldn't have done it if God wasn't there.
Okay, እሺ ወደ አንቺ ልምጣ። ሰላም፣ እንደዚህ እያወቅሽው ስለ አድቫንስድ ዳይሬክቲቭም ሆነ ስለ ፖልስትም እንደዚህ ዕውቀት እያለሽ በአካባቢሽ ያሉት ሰዎች ሊጋል የሆኑ ዶክመንቶችን ጽፎ የማስቀመጥ ያምኑሻል? እንደዚህ አይነት ኮንቨርሴሽን ስታደርጊ አንቺ አሁን ዕውቀቱ አለሽ። እንግዲህ ኮምፔር ላደርግ የፈለኩት እኛ ዕውቀቱ የሌለን ይሄንን ነገር ከቤተሰቦች ጋር ለመነጋገር ይከብዳል ብዬ አስባለሁ። ላንቺ በእርግጠኝነት በስራም እያየሹ በሁሉም እያየሹ ላንቺ ይቀላል ወይስ ስቲል ከባድ ነው ከቤተሰብ ጋር እንደዚህ አይነት ነገሮች ለመነጋገር? ሰላም።
ከቤተሰብ ጋር ቢሆን ወይንም በስራ በኩል different people from different cultures, it's still a very taboo subject. It's not easy to have these conversations at all. Even expect them that they understand the disease process or what's going on with their health. Even in Nasunkwan, they don't have the information. So information is very crucial for our community. I'm not even surprised. Even Barasi family, it's a new conversation to be have. And so empower Lamara community to help people understand. This is the first step in having a conversation and having an idea of what it is about, and to even know that these options are available for you. So when it comes time to making these decisions, it's not new information, and you know who to reach out for, or you know people in the community that may be understanding about these issues. Narsum Hona, you still have to explain to people you would assume that they know this information. They still don't understand. Even when you explain it, there's a lot of hope. We're all human beings. There's a lot of hope. Someone you love, someone who's your family member, your parent, your child, you have a lot of expectancy, especially if you're not born and raised in America. You have culture, you have religion, you have a lot of faith. So it's very much, there's a lot of resistance, and then on top of that, there's a new subject, even in the people that you assume that might know this information. So በየራሳችን family እንኳን ብንጀምር, even in our own family, it's something to be had, a conversation to be had. We're not living in Ethiopia anymore. It's a different life that we're living here. It's a Western medical environment. A lot of empowerment is given to the patient to decide how their life would end. Yet again, they have training and understanding that there are different cultures and there are different people who might have special considerations and values when it comes to their religion and their culture. So እነሱ በራሳቸው ተምረውም ቢሆን it's important for us to stand up and advocate for ourselves too. So yeah, it's still a challenging issue in almost every community that I can think of.
Okay. እስከዳር አንድ ጥያቄ ከዚህ ጋር ብሬ ልጠይቅሽና ለምሳሌ እንደሚታወቀው እድር ላይ ያቺን የመጨረሻውን ቀን የመቀበሪያችንን ለማሰብ በጣም ጎበዞችም ነን። ደሞም ለዛም አሁን እንደሚታየው በሎስ አንጀለስም በሌላውም አካባቢ በማህበረሰባችን ውስጥ አይ እኔ እድር ካለኝ ድረስ ወይ ኢንሹራንስ ካለኝ ድረስ በቃ ሌላ ነገር አያስፈልገኝም፣ እቺ የመጨረሻዎቹን ቀናቶች አናስባቸው እና አንቺስ እዚህ ላይ የምትጨምሪው ነገር አለ ወይ? እስከዳር አሁን ያቺ ቀን ብቻ አይደለችም የመቀበሪያችን የምትሞችበት ቀን ሳይሆን ከዛ በፊት ያለውም ማተኮር አለበት ብለሽ ምልክት ሰጪናለሽ? እስከዳር
thank you for that question. ይሄ በጣም ከባድ ቶፒክ ነው። ሰላምም ማርታም እንዳሉት ከፋሚሊ ጋር እንኳን ዲስከስ ለማድረግ ከባድ ነው። ግን ምክንያቱም ምንድነው ማሰብ ያለብን አገር ቤት ብንሆን ኖሮ ምን ያህል ቴራፒ ይኖራል ነው። እዚህ ሀገር ሜዲካሊ አድቫንስም ስለሆነን ምናምን በጣም ብዙ መደረግ ያለበት ነገር ይደረጋል። የ90 ዓመት ሰው እድሜ የሆነን ሰው ሴቭ ለማድረግ ይሞከራል። ምን ማለት ነው? ፎከሳችን ምን ጋር ነው መሆን ያለበት? ኳንቲቲ ሳይሆን ኳሊቲውን ፎከስ ማድረግ አለበት። ለምሳሌ አንድ ሰው ቅድም ማርታ ወይ ሰላም ቬጂቴቲቭ ስቴት ብላለች። ምን ማለት ነው እሱ? ጭንቅላታችን መስራት ካቆመ በኋላ we're considered as vegetables ማለት ካሮትም ሊሆን ይችላል፣ ፖቴቶም ሊሆን ይችላል፣ ካቤጅም ሊሆን ይችላል። እንደዛ አይነት ነው ሪፈር የምንደረገው as human beings። ምን ማለት ነው? መሽን ነው የሚተነፍስልን፣ መሽን ነው ባዲያችንን የሚያስኖረው የሚያቆየው ማለት ነው። ጭንቅላታችን would have no chance of recovery ማለት አንድ ዶክተር አይደለም ይሄን ዲሳይድ የሚያደርገው። it takes 2 ዶክተሮች ማአት ስተዲስ ምናምን ተደርጎ ነው እዚህ ጋር ዲሲዥን ጋር የሚደረሰው። እና ማሰብ ያለብን ምንድነው ህክምናም በጣም ሲበዛ አድካሚ ሲቹዌሽን ላይ ያደርሳል። ለቤተሰብ ደግሞ ምንድነው ችግሩ? ለምሳሌ አሁን እኔ የእውነት እኔም ሄልት ኬር ውስጥ ስለሆንኩኝ ወንድሜም ሄልት ኬር ውስጥ ስለሆነ ከእናቴ ጋር ኮንቨርሴሽኑን ተነጋግረናል። ቤታችን ውስጥ ግን 4 ነን። እኔና ወንድሜ ተስማምተናል። እናታችን የምትፈልገውን ነግራናለች። እንዳታቆዩኝ እንደዚህ እንዳታረጉ ብላለች። ሁለቱን ወንድሞች መንታ ናቸው። ስነግራቸው አሁን ከኛ ጋር አይስማሙ። ምክንያቱም ምንድነው እናታችንን እንዴት ነው ዝም ብላችሁ ይለፈርጎ ይሄ ዲሲዥን እሷ በትነግረንም ወደፊት እንደዚህ አይነት ዲሲዥን ላይ ብንደርስ definitely paperwork ያስፈልገናል። ሊገል የተጻፈ ወንድሜን ወይ እኔን እንዳለችው ሄልት ኬር ፕራክሲ አርጋ እናቴ እንትን ማለት አለባት እንጂ ይሄንን ዲሲዥን ማሰብ ያለብን ምንድነው አክሲደንትሊ የሆነ ነገር ቢደርስብን ለቤተሰብ ውሳኔ መተው በጣም አስቸጋሪ ነው። ምክንያቱም ለእናቴ ትክክለኛውን ዲሲዥን ያረኩት ወይ ትንሽ ፋይት ብናረግ ወይ ሚራክል አለ ጸሎት ያረግን ነው ልትድን ትችላለች የሚባል አስተሳሰብ አለ አይደለ? በዛ መሃል ላይ ምንድነው የምናየው ሆስፒታል ውስጥም ቢሆን እድሜን በመናራዝምበት ጊዜ ቀን ተወስኗል አይደለ? እቺ ምንገፋት ጊዜ የስቃይ ነው የሚሆነው። ለዛ ነው አንዳንዴ ትንሽ ሁላችን ፈታ ብለን ስንነጋገር ለምሳሌ እኔ ለረጅም ጊዜ እንደ ማሽን ውስጥ መሆን አልፈልግም ቲዩብ እንዲከተትልኝ አልፈልግም ሃምበርገር እስከ ለቴ ሞቴ ድረስ እየበላው ነው መኖር የምፈልገው ማለት መቻል አለብን ያ ምንድነው ለምሳሌ እናቴ መብላት አልዛይመርስ ዲዛታ ያድርስባትና ማሰብ ቢያቀታት መብላት ቢያቀታት በጭራሽ ቲዩብ አልከትባት ምንድነው ያለችኝ ሃምበርገር እስከ መጨረሻው ልብላ ብላለች ስለዚህ ይሄንን እንዴትም ብሎ ዲስከሽን ይሄ ሁሌ ግሪምና ሆፕለስ የሆነ አይነት ዲስከሽን ሳይሆን መሞታችን አይቀርም ምንድነው አባባሻ በታሪክ ምንድነው የሚባለው ተረቱ ምንድነው አሟሟቴን አሳምርልኝ ይባላል አይደለ ስለዚህ ኦን ዘ ዌይ ባንሰቃይ ጥሩ ነው እምንል ህዝብ ኮሚኒቲ ከሆነ ካሁኑ መጨረሻ የእድሩና አቀባ ከሞትንማ በኋላማ አፈር ውስጥ ከተከተትን በኋላ ይመቸን አይመቸን ምንም የምናውቀው ነገር የለም አይደለ ግን በህይወት እያለ ምን ያስፈልገናል ምን እንድነው የምንፈልገው በመብላ እስከ መጨረሻው ልብላ ራሴ የተነፈስ መኖር ካልቻልኩኝ መኖር አልፈልግም ይሄንን ዲስከሽን በጣም ኢምፖርታንት ነው ቀድም ደሞ አንድ ጥያቄ ምን ጠይቀሃል ለምሳሌ ያንግ ለሆነ ሰው አክሲደንት ቢደርስበት ማን ይወስናል ነው እሱ ደግሞ next of kin የሚባል ነገር አለ ለምሳሌ እኔ አንድ ነገር ቢሆን ለባለቤቴ ዋናው ዲሲዥን ሜከሩ ነው የሚሆነው ባለቤቴ ደግሞ ከሌለ ወንድም መጥቶ እኔ ወንድሟ ነኝ እኔም በቃ I'll be involved in her care ካለ እሱ ዲሲዥን ሜከር ይሆናል ስለዚህ ሁሌ there is someone that can make a decision question ምንድነው ይሄ ጸጸት እንዳይኖር ይሄ ትክክለኛ ዲሲዥን ነው ወይ ይሄ ትክክለኛ አይደለም ወይ የሚለው ነገር ከቤተሰባችን ጫና መውሰድ መቻል አለ ራሳችን ይሄን ነው የምፈልገው ይሄንን አልፈልግም ይሄን ማለት ይሄን ዲስከሽን መፍራት አያስፈልግም ምክንያቱም ቀን እንደው ተወስኗል ለዘላለም ማንኖር ሰዎች ነን ነገሩን ማስረዘም ትንሽ አስቸጋሪ ነው
እሺ በጣም ነው ምናመሰግናችሁ በእውነቱ በቀለለ መንገድ እንደገና መነጋገር ያለብን ነገር ይመስለኛል በእኛ ማህበረሰብ ውስጥ ይሄ ትልቅ ምክር ነው ለሁላችንም ይጠቅማል በልብናስበው ነው ከዚህ ላይ ማርታና ሰላም ጨምሩበት ከሌለ አሁን ወዳለንበት ወደ እንግዲህ በከተማ ውስጥና በአገራችን በዩሮፕም ያየነው ያለነው ያስነገጠ የመጣው የኮቪድ ነገር ነው እና አይ ኖ በንግግራችን ውስጥ አልነበረም ግን እንደው የምትነግሩን ነገር ካለ ስለ ኮቪድ አንዳችሁ ያለንበትን ስታተስ የምታውቁ ከሆነ በሎስ አንጀለስም አካባቢ የሚሆነውስ ነገር ምንድነው ይሄ በዌዘሩ ስለሚቀየር አሁን ዊንተር ላይ ይበሳል ሆሊዴይ ነው ሰው ይገናኛል የሚለውን ነገር ትንሽ ብትነግሩን ባካችሁ I think it's good አንቺው ላይ ሄደ
sorry እንግዲህ አሁን ኮቪድ በጣም በሚያሳዝን ሁኔታ ነምበሩ እየጨመረ ነው especially the past week አሜሪካ ውስጥ ብቻ anywhere to 80,000 to 100,000 cases daily ነው እንትን የሚደረገው recorded የሚደረገው ያለው ምን ማለት ነው definitely እስካሁን ፓንደሚኩን ኮንትሮል አላረግነውም it's getting worse ብዙም የሚታወቅ ለምን ይሄ happen አረገ ለማለት እና ለመመለስ ትንሽ ከባድ ነው በፊት ከተማው እየተከፈተ ስለሆነ ነው ምናምን ይያልን ነበር አሁንም maybe there is a potential open ስለተደረገ ሊሆን ይችላል ግን ቢሆንም every day ከ80 እስከ 100,000 people test positive ማድረግ ማለት በጣም disastrous ነው on top of that ደግሞ daily death is about 1,000 to 1,200 Americans are dying every day ማለት ትሪትመንት ቱ በርግጥ ብዙ ሪሰርች እየተደረገ ስለሆነ እየተደረሰበት ነው ማለት አሁን ፕሬዚዳንቱ መቼስ ከዳነ በዚህ እድሜው ለሌላው ሰው የሚያቀት እንትን አለ ማለት አይቻልም ግን እንደዛም ቢሆንም በጣም አስከፊ ሁኔታ ላይ ነው ያለው እና አሁን በዓል ቴንክስጊቪንግ እየመጣ ነው ክሪስማስ እየመጣ ነው ኒው ይርስ እየመጣ ነው እና በተቻለን አቅም ከዚህ ከምናረጋቸው የምንገናኘው ሐሳብ አለን አምሹር ይሄንን በጣም እንትን ኬርፉል መሆን አለብን ቢቻል አለመገናኘት ነው በአንድ ሃውስሆልድ ብቻ ማክሲመም የተባለው ሲዲሲ የሚለው ምንድነው ሁለት ሃውስሆልድ መገናኘት ይችላል ማለት የምታቁት household እስከሆነ ድረስ ለምሳሌ እኔ እና ወንድሜ ቤተሰብ ልንገናኝ ይችላል ይሄ ምንድነው if I know the culture የወንድሜን ብዙ እየወጣ ከብዙ ሰው ጋር ማይገናኝ ከሆነ ማስክ የሚያደርግ ከሆነ ምናምን it's reasonable ብንገናኝ ግን ይሄም ቢሆን ማስክ መደረግ አለበት 6 feet distance መጠበቅ አለበት outside ነው ሚቲንጉ መሆን ያለበት እና no more than 2 hours even in the outside setting exposure ማለት ምን ማለት ነው ለምሳሌ አንድ ሰው test positive ካለ ሰው ጋር exposure ካለኝ it's enough within 15 minutes closed space እስከሆነ ድረስ I could get COVID from that person ስለዚህ ይሄ disease በጣም contagious ስለሆነ አሁንም ብዙ ሰው እየታመመ እየተያዘ ስለሆነ መጀመሪያ ላይ የተፈራው ምንድነው በጣም ብዙ ሰው ቴስት ፖዚቲቭ ሲያደርግ የሜዲካል ኮሚኒቲውን ኦቨርዌልም እናረጋለን ተብሎ ነበር የተፈራው therefore አሁን ያለው ሲቹዌሽን ላይ there is a high chance medical community overwhelm ልናረግ የምንችልበት ስለዚህ በተቻላችሁ አቅም እባካችሁ ማስክ ማረግ አትርሱ hand washing 6 feet distance መጠበቅ በተቻለ አቅም ኤሪያ የምትጠቀሙበትን ክሊን ማድረግ and I'm not sure ከሰማችሁ about 15% of COVID cases ከሬስቶራንት ነው የሚገኘው ተብሏል እና በተቻለ አቅም የምትችሉ ከሆነ ውጪ አለመብላት የሚቻል ከሆነ እና ብዙ ጋይድላይኖች እየመጡ ነው አሁን ትሪትመንት እና ሌላ ደግሞ መመክራችሁ ምንድነው በጣም ይሄንን you have to pay attention in case if you do get COVID now if you have trouble breathing of course last time እንደተነጋገርነው ሆስፒታል መምጣት ይኖርባችኋል ሆስፒታል መምጣት ካለባችሁ you have to go somewhere reputable meaning teaching institutions in the cedars ያለ like ተለቅ ያለ ደህና የሆነ የኮሚኒቲ የሆነ ሆስፒታል ሳይሆን ተለቅ ያለ ብዙ equipment ያለው instrument ያለው ብዙ ቲም ያለው ሆስፒታል ሂዱ ምክንያቱም ትንሽ የኮሚኒቲ ሆስፒታል ከሄዳችሁ ትሪትመንቱ ማይናቢ አስሮበስ ሌላ ቦታ እንዳለው ይሄንን እንግዲህ በጣም ኢምፖርታንት የምንለው ነገር ነው እና ያው በተቻላችሁ አቅም stay away from gathering ከሰው ጋር እናንተን ማለት መቻል አለብን
እሺ ማርታና ሰላም እዚህ ላይ የሚጨምሩት ከሌለ እንግዲህ ዛሬ የተነጋገርነው በጣም ከበድ ያለ ኮንቨርሴሽን የእውነት ሁላችንን የሚያነቃ ሆኖ ግን ማሰብን የሚጠይቅ እና ብዙ ያልተለመደ ስለሆነ ማርታም ግልጽ ሆነሽ ለኛ የራስሽን ፐርሰናል ኤክስፒሪየንስ ሰላምም እስከ ዳርም ጊዜያችሁን ሰጣችሁ እንደዚህ አይነት ከበድ ያለውን ነገር ከኛ ጋር ተነጋገራችሁ በጣም ነው የምናመሰግናችሁ የምትጨምሩት ነገር ከሌለ መልካም ሳምንት እንመኝላችኋለን ሁላችንንም በሰላም ጠብቆ ለሚቀጥለው ሐሙስ ያድርሰን እንግዲህ ደህና ሁኑ እንላለን ይሄ ኢንፎርሜሽን ፌስቡካችንም ላይ በኢሜይላችሁ ይላክላችኋል ያላያችሁ ድል ያልገጠማችሁ ይሄን ለማየት ትችላላችሁ መልካም ሳምንት በሚቀጥለው ሳምንት እንገናኛለን ደህና ሁኑ ላለው
thank you መልካም